is Madame Gazelle. A child is ill.
Don't panic. I'll come straight away.
What did I just hear? Eyeballs where they shouldn't be, saying ah. And does this guy look familiar? Today we are breaking down and reacting to all the far out medical scenes and absurd injuries from something I am told is called Peppa Pig Parodies. So clearly it's not a kid's show. All right, let's dive right in.
Hi, I'm Peppa Pig, and today I get a medical exam.
Okay.
Well, Peppa, I've got the results for your medical scans.
Why does this character almost look like me if I have a beard that's growing out?
But I'm afraid it's not good.
Yippee!
Have you noticed the misplaced eyes on the side of your head and the engorged tumorous snout?
My mum says they're pretty.
We are all made differently. Sometimes people's eyes are actually closer together and sometimes they're further apart. It could be indicative of somebody who having a genetic type disorder, but doesn't necessarily mean that it is detrimental or that it requires surgery.
These are severe genetic mutations that require surgery
Oh my
immediately.
goodness.
Oh dear, what if I don't make it through the operation?
At the hospital, what I do for a living is we determine if somebody actually requires emergent surgeries. We'll find something and discuss it with the surgeon and say, hey, does this individual need to be admitted to the hospital, or can they follow up with you at the office and schedule a surgery as an outpatient?
Well, Peppa was sold to the local butchers and the town was fed for weeks.
Oh my gosh. If the town is made up of pigs and then the other pigs are eating pigs, Houston, we have a problem. We don't do that. Eating human tissue, there's a rare disease called Carew, which has to do with prions and ends up being proteins that are in contaminated tissue.
Oh dear. Pedro has
coronavirus. Not to worry. I'll ring Dr. Brown Bear.
COVID-19, a viral illness that wreaked havoc for many years, still causes potential severe illness in people who are highly susceptible, weakened immune system, elderly. It is now treated like other coronaviruses that have been out for a long time.
Dr. Brown Bear speaking.
Hello, doctor. This is Madame Gazelle. A child is ill.
Don't panic. I'll come straight away.
What did I just hear? Kids in general always have germs. They're always getting sick. One, they're building their immune system, and the other is they're not the cleanest people in the world. They're, not washing their hands. They're rubbing their nose. They're touching. They're spitting. They're kicking.
What seems to be the problem?
I've got...
Ligma.
What do you mean?
Ligma? What you ask? Ligma balls.
Oh my god. I'm like, is it a ligament? Is it like some weird tropical infectious disease? Inappropriate.
I've got...
Coronavirus. I see. Is it a tickly cough or a chesty cough?
So tickly cough versus chesty cough. I get what the doctor's trying to describe. Is it like something tickly in your throat? So is it more of an upper respiratory infection? Or is it deeper down in your lungs concerning for maybe like a pneumonia or a bronchitis?
I don't know, but it goes like this.
Exactly what I was saying about kids just sharing their germs with everybody else.
Do I need medicine?
Just a little spoonful. I'm afraid it doesn't taste very nice.
It tastes like...
These nuts.
Okay, inappropriate again. You can use honey as long as you're older than the age of 1. It has to do with botulinum, a neurotoxin that potentially can get into honey. Or maybe the doctor is starting to give like an antibiotic.
Thank you for looking after us, Dr. Brown Bear. Who looks after you when you're ill?
No one looks after me.
Aww. Very rarely do doctors get sick. I will say also that doctors do not call out of work. If you actually end up having to be so sick that you can't go to work, you find a replacement for you. And if I do get sick, I still have to even go to the doctor's office as well.
It is home time, and the children's parents are here to pick them up.
Mummy, Daddy, I've got...
Coronavirus. Run.
Somebody can be quite contagious. Some are airborne, some are contact, some are droplet. It just depends on how they're processed.
Of course, Peppa.
Yeah.
Oh, the teacher's got it now. Sharing is caring. Oh, everybody's got it.
Oh dear. All the grown-ups have caught
coronavirus.
Viruses go down different paths. Usually it's like they spread really, really easy, but their severity of disease is kind of light, versus if the virus was so deadly and dangerous, it actually potentially could burn itself out because you don't have enough time for people to share the virus with other people.
And I've got
Diabetes.
Speaking of farts, remember farts are good. Make sure you get them out. That way you don't get dilation of your intestines and abdominal pain.
This is Dr. Polar Bear.
Dr. Polar Bear had a very bad episode right there of nystagmus, when the eye actually has a ticking motion. Could be related to vertigo, could be related to alcohol intoxication, and it actually could be related to a cranial nerve palsy.
Who do we have here?
Your mama.
Excellent.
Excellent.
Let's start by seeing how tall you are. Come and stand by the wall here, please, Peppa.
I'm a big girl now.
So quite common when you go to the doctor's office, height, weight. There's a reason for that. One, you want to make sure your growth, and we want to see basically how you are compared to everybody else.
Now, hop onto these scales for me, please.
All you international viewers out there would be surprised we actually use kilograms in medicine here in the United States.
That's
Not.
good. Now, I will listen to your heart with my stethoscope.
Let me out, please. Let me out of here.
That's really funny. Oh my gosh. No, it doesn't sound like that. It's lub dub, lub dub, lub dub.
Bumpy dump, bumpy dump,
Bumpy dump. That's pretty good.
bumpy dump, bumpy dump.
Now I'll check your ears with my special torch. Now I'll check your mouth. Say...
Okay, you know, it's not a torch. It's called an otoscope, and it's just a light, so we can see and we can look through. And we're looking to make sure the canal is open, and we're making sure that your eardrum looks good and healthy.
Nope. Nope.
Most of the time, if you actually go and look at yourself in the mirror and you open your mouth, your tongue is in the way, seeing those structures. When you say, ah, everything drops down and you can look back there.
Let's see you jump up and down.
Nice.
Do you like eating fruit and vegetables?
I actually ask people when they have abdominal pain and I'm concerned about appendicitis to actually see if they can jump up and down or shake the hospital bed, because if that causes discomfort, that means there's inflammation within the abdomen itself. So this was quite interesting. You know, there is some medical components to it that I deal with on a daily basis. So not bad. You know, some of it's a little bit raunchy, but outside of that, it was quite entertaining, even for myself. This is the first time I've ever seen this. So if you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.